This is the best diagram that is available to explain the importance of doing a fasting insulin test. Okay, the upper diagram graph shows whenever the insulin resistance increases more than 2.5 or 3, the chance of getting high insulin levels increases, chance of atherosclerosis, hypertension and heart attack. The lower diagram indicates HOMA-B. Upper graph is HOMA-IR, insulin resistance. Lower graph is number of beta cells that are there. The beautiful of this diagram is at one graph, in one image you have two graphs. Upper graph indicates that as you are increasing your insulin resistance and you are producing more amount of insulin, the cardiovascular events, cancers, polycystic ovarian syndromes, obesity, central obesity are all high. So as beta cells are good, but the only HOMA-IR is high. Most of the time, 65% of the Indians, they present only a central obesity. That is, the waist circumference will be high, but no other disease. All the tests will be normal, BMI will be normal, HbA1c will be normal, blood sugar will be normal, total cholesterol will be normal. These people think they are healthy, but already metabolic dysfunction has started. Second graph that is shown in the down one is whenever the beta cells are till 33% of 65% of the beta cells are destroyed, the HbA1c is normal. Once you start losing more than 70% of beta cells, suddenly you can see rise in the blood sugar. That is why whenever you will be seeing 1 month, you go to a doctor, the blood sugar is, fasting blood sugar is more than 220. Next month, you do some exercise and diet, suddenly the blood sugar will be coming down to 120. Again, you go to the next month, the blood sugar will go to 300. You take number of tablets, 3 tablets, 4 tablets, still the blood sugar will be going high, because as the number of beta cells are getting destroyed, how many number of drugs we pump in, there is no chance. So this image is very important for every doctor to understand. 60 to 70% of Indians will have both HOMA-IR with HOMA-B. That is, on one side there will be insulin resistance will be high, and the other side the insulin production where HOMA-B is very low. So it is a double whammy. We have two sides. One side, in India our inflation is very high, on the other side our employment is very low. This is a classical case like India where the taxes are very high and there is no employment. This will fall a big burden on the public, where out of 150 crores, more than 35 crores are always constantly unemployed. Similarly, in we're doing a home insulin test, you can tell who will develop heart attacks and cancers and PCOS, infertility and gestational diabetes. At the same time, by checking the HOMA-B, you can predict the chance of getting a diabetes. So this graph is the heart of my argument of insulin resistance. Thank you.